It is a pleasure to be here, and thank you for coming and attending and talking about this topic, especially Senators Whitehouse, Portman, Klobuchar, and Ayotte and their offices. We are delighted for your support and attention to this growing epidemic. I hope this is going to be one step in a continuum of addressing this side of the opiate crisis. And I wanted to share with you a story that came from my district that was brought to our attention about a year ago. And it was a baby, a newborn in one of my communities of Malden, Massachusetts, who was born dependent on heroin. And his seizures were so powerful from his withdrawal, it actually ended up detaching the retina in his eye. And this heartbreaking scene is a similar scene playing out in every congressional district in this country. And the rate of occurrence is surging at an alarming, rate. If there is a takeaway from the decade of America's exploding opiate crisis, is that it knows no limits. It doesn't care what your socioeconomic status is, education levels, whether you live in a red state or a blue state. And in battling opiate abuse, we are focusing on the youngest victims of this problem, newborns who are suffering from neonatal abstinence syndrome and withdrawing from these dangerous drugs. They experience the same pain that adults report as the worst pain they've had in their lives. It's the pain of drug withdrawal. They are born suffering from seizures, breathing problems, fever, tremors, stiff limbs, difficulty feeding, and can experience these symptoms for months and can lead to weeks of hospitalization. And sadly, this problem is also on the rise. Nationally, over the last decade, NAS births increased threefold. The steep rise in opiate addiction across the country has led to one baby born suffering from neonatal abstinence syndrome every hour. In my home state of Massachusetts, the numbers are even worse. In the last 10 months of 2014, over 1,700 babies were born with NAS. And for the last several years, Massachusetts has had a rate of NAS births that is 3 times the national rate. This is not only unthinkably cruel pain for newborns, it is a costly problem for our hospitals and our society. These NAS births are 5 times more costly than healthy births, and Medicaid pays for approximately 78% of these costs. States vary in addressing the problem and collecting data, with some collecting incomplete information and others none at all. This severely hampers a state's ability to identify the scope of the problem and apply effective solutions, leaving many hospitals on their own when it comes to piecing together the best methods to diagnose and treat NAS. We believe there's a simple, common sense way for Congress to be proactive in helping babies born with this condition while saving Medicaid dollars. We also believe, and we think this is bearing out, that this is a non-political issue and a non-controversial one. If we can help the newborns who are suffering and reduce medical expenses at the same time, we should do it, and we should do it right now. We have sought partnership and advice of doctors across the country to see where we could help. We're very proud to have partnered with Congressman Steve Stivers in the House and Majority Leader McConnell and Senator Casey in the Senate to introduce our bipartisan bill, the Protecting Our Infants Act. It is the first federal legislation that will take proactive steps to help doctors, nurses, hospitals, and health agencies that are struggling to address the epidemic of newborns suffering from opiate dependency. The bill will require the Department of Health and Human Services to develop recommendations to prevent and treat prenatal opioid abuse, and NAS review its programming to develop a coordinated strategy to address this crisis and provide assistance to states in the collection of public health data so they can respond as well. This bill will save us money. It will help us increase efficiency in our hospitals by identifying the best practices to diagnose and treat these newborns, and in our state and national health agencies by coordinating programs and ensuring we have information we need. My staff is here. John Mareschi, raise your hand, and they can help you learn more about this bill. Please use my office as a resource, and I thank you so much again for your attention to this important matter and for being here today. Thank you.
Thank you so much.
Thank you, Congresswoman. Thank you.